This presentation is on the topic of health literacy. The purpose of having this discussion is to understand what health literacy is and how it affects our patients. We will also touch on some practical strategies that can help providers do a better job caring for people with low health literacy. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services. The purpose is to help anyone using health services being self-sufficient to determine needs and make appropriate health decisions. Our clients come to know Vasilud with various levels of education or literacy. They may prefer speaking their own language, or they might be going through the challenges of the illness for which they are seeking care. These issues can become barriers to understand health information. The objective is to generate an integrated navigation process that may include different types of encounters, helping improve the effectiveness and ultimately improving the efficiency of the care continuum of the client. During 2023, the Ryan White program supported 96 clients, from which 86% were Latinos. 80% of the clients had a low level of health literacy. At Novasalud, we've learned that it is best to approach care with the understanding that anyone may struggle with health-related information, regardless of education level. At the end of the intervention, we provide clear information of future encounters and use simple and clear language to avoid any opportunity of misunderstandings. Low levels of health literacy have many effects on the behavior of clients. They may span from missing appointments, incomplete registration forms, clients being unable to name medications, their purpose and dosing. That may lead to non-compliance with medications. There are important recommendations to address when contacting the patient. Ask clear and direct questions. Hear and help the patient to tell their story in a coherent and sequential way. Support the patient and follow through, test, and referrals at the end of the encounter. If questions about prescriptions arise, discuss usage, purpose, and side effects. The conflict of information between the client and provider arises from gaps in the communication process. The client must understand, remember, and act on the information that they are provided with. What we've learned so far. Our community health workers have developed good knowledge on how to improve communication and increase health literacy. Some of these steps are asking what is wrong, discussing what to do and why, and emphasizing the benefits. Also, our community health workers discuss what the medications are for, recommended dosing, the benefits, as well as potential side effects. By focusing on the need to know and need to do, we create a concise flow of information. Utilizing the teach-back method along with clearly written educational materials, we empower the client's health and wellness. Further focusing on what the client needs to know and needs to do, we spotlight the most important parts of the client's care. This way, there is minimal opportunity for misunderstanding. The client arrives knowing what to ask and leaves knowing what to do after a provider's visit, such as the proper dosing for their new medications, follow-up appointments, referrals, and post-visit self-care. Using the teach-back method can help the provider assess the client's knowledge by asking the client to teach it back to them. The healthcare provider can then identify misunderstandings and clarify their instructions. This cycle can be repeated until there is a shared understanding. Don't assume. Explain things clearly and specifically. Use plain language, no nicknames or jargon that is not understood by the client. Limit your key points to 5 points. Demonstrate with pictures and models, draw if needed. Repeat the instructions and summarize at the end. Teach back whenever is needed to confirm that your instructions were processed by the client. Visual information and models have been proven a great help to support clients' literacy. Here is an example on the difference between HIV and AIDS directed to Spanish-speaking clients. This is about antiretroviral treatment. How to understand lab results for HIV-positive clients. Seropositive client differences and how to prevent HIV transmission. Using the client center model has been an effective tool to structure processes at Novasalud. All our resources align to offer the client services that provide care conveniently and sequentially. Ask these questions to analyze your situation. Thank you.